Hello, and welcome back to episode 13 of the COVID Long Haulers podcast. We share real stories from those living with long COVID, what they faced, how they're coping, and surviving. My name is Emerson, and I'm co hosting today with Jessie.
Hello.
Today we are speaking with Noah, a 23-year-old former gymnast from South Dakota whose life changed drastically after a COVID infection in 2024. Noah has been lucky enough to improve his health through a variety of new and experimental treatments, which we are excited to discuss in depth today. Hi, Noah. Welcome to the show.
Hi, thanks for having me first off. My name is Noah Hansen. I was a college gymnast. I trained since I was 9 years old. And then I got COVID in 2024, and my life changed significantly. I also had a few life events leading up to that also were pretty stressful that I feel contributed. So I'm just here to share my story.
Oh, and we're so glad that you are willing to share
Yeah.
your story with us.
Oh, of course. Thanks for having me.
You
Yeah.
first got COVID in 2024. What was
Yes.
your infection like? So, was it a mild infection? Was it your first infection? How did all of that go?
So I don't know if it was my first infection. I'm not entirely sure. I had a very mild infection. I just had really bad mucus, like snot, and I was just stuffed up. But I didn't run a fever. I wasn't sore. I wasn't tired. I wasn't out of breath. I wasn't any of those things. And I waited a week and I jumped right back into practice. I had a meet the next weekend, so I had to keep training.
Yeah.
I wanted my lineup spot
Did you
to compete.
know that you had COVID then? Like, did you take a
Yeah, I did. I went to urgent care and they were like, "Oh, you got COVID." And I was like, "Shoot."
So you had a mild COVID infection, and you also have some pre-existing conditions that might have elevated your risk or contributed to your long COVID. Can you tell us about that?
I've been a type 1 diabetic for 22 years of my life. I was diagnosed at 11 months old, the week
Oh,
before Thanksgiving. Both my parents are type 1. I also have a twin brother and he doesn't have it. But that's one thing. And then since developing dysautonomia, long COVID, and these things, I've started to realize I had signs of maybe developing dysautonomia way beforehand. And it
yeah.
kind of started when I was in my early childhood. I had crippling anxiety and fear. And they were like, oh, he just gets so worried. I don't want to say I had OCD because I wasn't diagnosed with OCD, but it was very obsessive compulsive worrying about the craziest things,
So, like, your nervous
like
system was overactive.
extremely, and anything could have triggered it. In 7th grade, I started getting health anxiety. I also have ADHD. I was diagnosed as a
Mhm.
3rd grader when I was 10. I always say I wish. We all do. I wish my providers would have been able to spot that earlier
Mhm.
and been like, "He may develop a nervous system
Yeah.
disorder when he's older. You gotta make sure you don't get sick." As a type 1 diabetic, I knew it wasn't good to get the cold or flu, and so I tried my best, but every time I got the cold, I recovered.
Yeah.
And
Yeah.
I didn't realize until we were researching for this episode that type 1 diabetes is an autoimmune
Yeah.
condition. I didn't
Yes.
know that, and because
Yep.
I don't have it, but that makes so much sense when you look at the research that people are so much more likely to develop autoimmune conditions after COVID if they already have one,
Yeah.
Yep.
but you also have this immune dysregulation that happens with COVID, so you were already kind of primed, you already had autoimmunity, and then
Yeah.
you
Yep.
got COVID, and
Yep.
it sounds like maybe your providers didn't even pick up on, "Hey, you have a type 1, you have to be really careful," right?
Right. It was always just more about type 1 management. That's kinda what your provider's there
Yeah.
for, to
Mhm.
help manage your hemoglobin A1C.
It's so frustrating because you had such a clear, obvious risk factor. Like, there's less obvious ones that are slowly being researched, things like ADHD and autism. But autoimmune diseases are so obviously a risk factor for any kind of post infectious, post viral, immune mediated condition.
And I knew it was possible, like, "Oh, maybe I could develop something when I'm older," but I always told myself because as a college athlete and an elite training athlete, like,
Yeah.
I'm
high
healthy.
level, high achieving type A individual, I felt invincible almost. I was like,
Yeah.
"I have a body built of armor." Before I got sick, I had so much muscle mass. I was a hardworking athlete. I strength and conditioned 4 days a week. and in practice. And I felt because I am so muscular and so healthy and I live such a healthy lifestyle, I just don't know or feel that I would ever have developed something else. I didn't think about it. And in my mind, I was like, well, I guess I do have a little privilege here because I have a male body. And usually autoimmune diseases are quote unquote more
Yeah.
predominant female.
Right.
And then I was healthy and I was a hardworking athlete, had a really clean diet. I was overjoyed with my life, so happy, having the best time all the time. And at the peak of my life, I developed something that I don't know where it's going to go now.
So, when did you realize that you had developed long COVID? Did you get officially diagnosed?
Yes. So I went and saw a few different specialists at Mayo Clinic in Arizona, and they weren't really able to tell me too much just because I was like, something's wrong, but I had nothing to pinpoint. Be like, oh, I had a COVID infection. I don't know what's going on. And then I met with an internal medicine doctor in Mayo, Arizona, and he told me, it kind of sounds like you have long COVID. My mom kind of clocked it. She had thought that maybe that was something. My mom came down with me and she ended up staying with me for 3 months to try and help me figure out my health problems while I was still trying to go to college and still trying to train. And I remember the one thing I will never forget him telling me, and I almost wish he never told me this. He said, your life is going to change forever, and I'm sorry for your struggles. I like to
Mm.
think he meant well in
Yeah.
telling me that in the nicest way possible. And I remember right after being like, well, am I ever going to build my muscle back again? And he
Yeah.
was like, I can't tell you yes. I don't know.
Yeah. It's so sad because long COVID or any kind of chronic illness, it is like a life sentence. You're not going to wake up one morning and be totally fine, right? You
Right.
wish
You
that
will
was the
always deal
case.
with some implication from this
Yeah.
infection, and some get worse, some have slight improvements.
Mm,
You don't know what's going to happen. This is all a waiting game.
So, Noah, what are your long haul symptoms? There's
All
probably
right. Those
millions,
are,
but
yeah, it's also hard to distinguish sometimes, like
or what got
what
worse?
is from having COVID or what is a normal life thing, My long hauler symptoms that I have dysautonomia, mast cell activation syndrome.
Mm,
I deal with debilitating fatigue, which has been a big work in progress. And I do feel I am seeing a little bit of improvement, which I am
yay.
so grateful for because
Yeah.
that is something I think I mean majority of people fatigue is
the
usually the biggest
worst.
thing.
Yeah.
Yeah.
And for me it still is, but it is improving to an extent. Sometimes I push myself into a PEM crash, but sometimes I am able to withstand just a little bit more, and for that I'm grateful. My muscles don't feel the way they did before. I have lost a lot of muscle, partly because of me not being able to do anything, because of deconditioning, but
Yeah.
also because of my immune system and mitochondrial function and all those
Yeah.
scientific things that they're finding that are creating muscle loss and twitching and nerve excitability. And I deal with muscle twitching as well. I did deal with facial swelling and some weight gain for a while until I got on hypothyroidism medication, levothyroxine for Hashimoto's disease.
Did you
Um,
have Hashimoto's before?
I did not. That's a new
Oh,
diagnosis. So I dealt with some swelling and edema, and then working with my dietitian, I actually have improved the swelling a little bit related to the Hashimoto's and the MCAS.
hmm
I also deal with dermatographism. So pressure on the skin or writing on the skin, scratching leaves raised red lines that itch and sometimes hurt, sometimes worse than others. A few weeks ago, if I would scratch my face, it'd leave a red mark for a whole day. And then other times it's there for 10 minutes, you know? Um,
yeah. I have
so
it on
feeling like,
one side. Like I have it on
yeah,
my left side only. And
yeah,
it's if I wear like socks that are just maybe a little bit too tight, I have a rash and I start to bleed.
yeah,
And just from socks, like it just the irritation or a seam
or anything. So it's
Yep.
like sometimes it's itching, sometimes it's like
Yeah.
damage just from
Or like,
contact.
right. Yeah, or like compression leggings for dysautonomia. Like
Yeah.
if they wrinkle up, sometimes it'll pull on my leg hair a little bit and then I'll have a rash on my legs. I would say for me, the dermatographism is obviously they're all worrisome because they all mean something. That is the least of my symptoms. Dermatographism doesn't really affect me as much,
Yeah.
but I do deal with the fatigue and like more musculoskeletal problems,
Yeah.
losing muscle and my deconditioning and PEM and
Yeah.
those things I struggle with the most. Everything just feels like 10 times more effort. It just feels a lot harder. And it's not just like the same as, oh, I just did a tough workout and my muscles are sore and I'm tired and I don't want to get out of bed. It's like,
Unexplainable fatigue that is life altering. Like, I think an outsider might say, oh, how could fatigue be the worst of everything you're describing, right? Like,
"Mm,
you can deal with a lot of pain, you can deal with a lot of inconvenience, but what is really hard to deal with is when you are incapable of doing at all.
Yeah.
yeah. I did deal with a little bit of breathing stuff briefly. I would say the first 6 months after my infection, when I was restlessly trying to figure out how to pace, and I was boom and bust cycling myself over and over and over. I would get pretty breathless pretty
Yeah.
quick. Treating my mast cells with supplementation, I feel has improved that for me, and some of the other treatments I've done, I feel like that has helped.
Yeah. Do you
Sure.
think that the dermatographia, do you think that that could be linked to the MCAS that you
Yes.
have? Yeah.
Yes. Yep, and I didn't have dermatographism before I got COVID.
Okay. So it's a completely new symptom that you all of a
Yes.
sudden was there.
Yeah, and also when I would eat something acidic, such as
Yeah.
citrus fruit or tomatoes or something like that, something my
Okay.
body didn't agree with, I'd get more red hands, like more blood pooling too.
And you mentioned PEM, which is, in my
Yeah.
opinion, one of the most evil symptoms that exists. What does that feel like for you?
Yeah, so after I have overdone it, and even when I'm trying not to, and I do, it usually starts with muscle twitching and neurological symptoms. So brain fog and just feeling foggy. And when I stand up, I do feel lightheaded more when I'm having PEM than if I wasn't having a crash.
So
Um,
worsening dysautonomia almost.
Yeah.
Worse, yeah, it just gets worse. And I usually feel pretty heavy in my limbs. I feel like weighed down to my bed, pretty
Yeah.
tired.
Like gravity is too strong and you're just like, "Ugh."
Yeah, yeah,
Yeah.
yeah. And for me, I'm still able to move when I'm having those symptoms, but thing just feels a lot harder.
Right. And there is this quote that I want to add here from the new Infection Associated Chronic Illness Provider Manual from Mount Sinai's Cohen Center for Recovery from Complex Chronic Illness. And that is, quote, PEM is distinct in both mechanism and trajectory. It is a delayed crash occurring hours or even days after minimal exertion and is characterized by a worsening of multiple systems, not just fatigue. The hallmark of PEM is that it is out of proportion to the activity that caused it and can take days or weeks to resolve. And I think this quote describes the situation and PEM perfectly. And I know it from myself that PEM often feels like I'm hungover, I'm jet lagged, I've got food poisoning, the flu, just kind of every uncomfortable experience I've ever had all at once. And it can really last for a very, very long time as well.
I do notice when I am dealing with a crash, I do also get a little bit of nausea. I am grateful for the fact that GI symptoms are not the most burdensome. I don't know how the virus affected me. Maybe I do have some gut dysbiosis. I don't know for sure. I would love to get that tested just to see. But I do occasionally get nausea and a little bit of GI symptoms when I'm dealing with PEM,
Yeah.
but it is not constant for me.
My layman's theory is that basically when I'm in a PEM crash, I get really bad digestive issues just because my body doesn't have the energy to digest.
Maybe
Yeah.
like not eat super as much solid foods, but
Yeah.
we will work on getting our protein in and trying our
Yeah.
best.
Yeah. Yeah.
So, Noah, I wanted to ask how specifically your type 1 diabetes has been affected by long COVID.
Yeah, thanks for that question. It's really interesting. I think for me, I got it pretty solid when I was in college, like my management down to a T. I did deal with quite a few low blood sugars frequently because of the excessive amount of activity I was doing and not really letting my body recover. And then when I got COVID, when I started noticing slight weight gain and swelling, I started having stubborn high blood sugars. And for a few months, I just felt so awful. When your blood sugar's high, the best way I can describe it is your muscles feel like molasses to me. And also,
Okay.
like, your muscles are being ripped through. That is something I
Okay.
sometimes deal with high blood sugar, and I was feeling that pretty frequently for, like, 7 months until I met my wonderful, wonderful dietitian, long COVID dietitian, Lily Speckler, and she helped me understand potentially why this was happening, and the theory that we on worked for me. Compression over the belly button, eating some bitters, some leafy bitter greens before you eat also can help curb. And then we worked on my protein to carb ratio intake, and that really helped things so much. And then we worked on upping calories so that my body didn't have to work so hard. So my body had enough fuel and enough energy to be able to try and do the function of healing that is possible.
Awesome.
That really helped my diabetes, and learning to properly hydrate with her was super helpful. And it comes down to my liver was dumping glucose into my bloodstream because of histamine reaction. And working on my histamine symptoms while hydrating and eating enough was able to help regulate my blood sugar and make me more insulin sensitive.
And that was all you learned from Lily Speckler?
I've learned so much from Lily. She's incredible. I mean, I highly recommend anyone to go look at her page, Long COVID Dietitian. Not only is she talking about diet, but she's able to help people understand symptoms and how diet can be applied to your symptoms to
Yeah.
try and improve those things. And she is a godsend, I will say. She's not someone you need to be careful of. She's genuinely a long hauler herself and
Oh,
has
that makes
such
such
a
a
great
difference.
heart. When
Yeah.
someone truly understands what you're going through, they're not going to give you a false promise. They're gonna be real with you, and there's been some times we've met where she's very real with me and is able to help me understand the magnitude of what's happening and
Mhm.
put it into perspective. I credit her for helping me with those because my endocrinologist didn't know what to do. So,
Oh, wow.
Amazing.
Wow, that truly sounds amazing and so helpful. For anyone who would like to learn more about Lily Speckler's work, you can find the links to her website and her socials in our show notes. So, Noah, what was your general experience like with medical professionals? You mentioned Lily Speckler being super, super helpful, but did you have other doctors who were maybe less helpful and less knowledgeable?
I did, in the height of trying to figure out what was going on with my body, I met with practically every single department. I was in 2 different states doing multiple appointments, online virtual appointments across the country with specialists to try and understand what was happening, and I was always met with, "Well, we don't know enough yet." It's like, "What do you mean you can't help me? Like, post-viral illness has been around since the beginning of time." I did get canceled and fired as a patient from immunologist at Mayo Clinic for basically him dismissing my symptoms. And in the heat of the moment, I think I was more frustrated. I said to his face, "Don't be a doctor if you can't be one."
But
Oh, I love
doctors need
that.
to hear that.
He said, "Don't be a doctor if you can't be one." And I got up and left the appointment.
Oh
I
my
said that in my
god.
letter.
We have
I
all
left,
wanted to say that.
That
you
must have
know?
felt so good
Oh,
to
I
do
felt
that.
so powerful. I felt so incredibly powerful in that moment. I'm suffering and you're not understanding and or even willing to try and help me make
Yeah,
sense of what's going on. And you went to medical school for all this time and you have contact with other medical professionals. They can read a research article too. This is
yeah.
other people's lives in your hands. And that's something that needs to be taken more seriously. And if they can't help, send me somewhere that will, or maybe we'll research it together.
Yeah.
Yeah.
Let's sit in the office together and let's both pull up an article and read what it says.
That would be amazing to have a doctor do that with you. You had another unfortunate experience with a provider from Instagram, right? You want to tell us about that?
I did meet with a doctor who I had seen over social media, and we spent $5,000, give or take, with this healthcare professional, and I was basically promised improvement. This person was super sly with their words and was able to convince me that what this person was going to do for me was going to make a difference. We did a bunch
Oh,
of lab work, lab testing, which was really interesting to see. The lab testing was incredible. It was very in depth and it made sense what this person was saying. But when it came time for the treatment, it was not just this much money to work with this provider, but thousands and thousands and thousands of dollars for all the additional things.
They're probably like supplements, right? So really
Supplements and
bad for your
working with
MCAS.
right, right. Working with supplementation, working with some other different things which can be helpful. And I think where I got lost in it was when I had to order upward 30 to 40 different supplements.
Oh no. Oh no.
30 to
oh,
40
wow.
and working with this person for 3 to 4 months. And then if you do it all by yourself from that on, the sky's the limit for you. Which for some people, maybe they were lucky enough that that was something that did help them with something. But for a long hauler, for people with physiological illness, immune system dysregulation, this is not going to be the number one fix. I'm so sorry.
No.
It may aid in some recovery and some stabilization, but I don't think the body can handle 40
No.
supplements for the
Oh,
rest of your life. And when this person was talking to me, it almost made perfect sense. And then I would ask a follow-up question, and the response looped back to something else to get me away from that topic.
oh, like a
Oh.
true salesperson.
Oh.
Yes. That's when
Oh,
I was really like, okay, yeah, we can't work with this person anymore. And that's when I had found Lily and I looked through all of her credentials and her journey and everything and the people she's worked with and testimonials and these things. And it made more sense and it felt practical. This is something that is more doable and reasonable and is backed by science.
yeah.
She is very good at being able to say, this study shows this. She's very good at researching. And, and I do take supplementation with her. It is not 30 supplements, but it is some things
Targeted.
to help stabilize the MCAS symptoms
Mhm.
Yeah.
to the
Well,
best of
like
its ability.
quercetin and
Yeah. And
like what you
DAO enzyme and
okay,
yeah.
Okay.
yeah.
And I felt like working with this grifter, if you will, it felt very labored and very difficult. It felt unachievable. It felt disappointing. It felt scary because I was like, "Wait, I'm not getting better when I was told that I would." When someone's like, "Yeah, in 4 months, you should hopefully be seeing improvement." Maybe for some people, they do see an improvement in 4 months, but for a
Yeah.
lot of people, it takes way longer to start to see improvements, and you have to be honest with people.
Everyone has a different immune system. That's why infections affect everyone differently. That's why we're long haulers and some people aren't. And for someone to make a claim that they are certain that an immune mediated problem is going to be solved in 4 months is absolutely a lie. And I'm so sorry that you had to go through that. And I hope
Yeah.
that our listeners can hear that and be on guard for when they might feel so
Yeah.
desperate.
I think that's what's so sad is that these people pry on desperate people and then they make
Ugh.
promises. When you look at the definition of long COVID, it says that you have to have had persistent symptoms for at least 3 to 4 months post infection because
Yeah.
the majority of people recover within the first 3 to 4 months. So if you get sick, And then you go to, like, say, this grifter that you spoke about, and he says you'll be fine in 3 to 4 months. The people who likely recover in those 3 to 4 months are probably people who would have recovered anyways
Right.
because,
Yeah.
like, the 3 to 4 months is just a threshold that exists for
Some people.
immune-mediated post-viral, post-infectious conditions.
Yeah.
And it's so frustrating that people kind of use that to take advantage of people and give them false hope when, I don't wanna say there is none, but,
Yeah.
like
It's not accurate.
Right.
It's not
yeah.
the situation that you're dealing with.
Yeah.
So,
Yeah.
which treatments did help you? So, we talked about Lily's stuff. So
Yes.
was there
I
anything
would
else?
put hers in my top 5 for sure. A lot of the stuff that she's putting out there for the community to see is very applicable to life, to your daily life, and broken down to the T of someone who's bedbound. Like,
Love that.
what is something most practical for people who are bedbound? She is able to do that. She's able to really capture the whole picture and apply what will be most practical to you in order for you to feel some sort of stability and control
Mhm.
in your life.
Yeah.
Because with long COVID, it is loss of control. It is a roller coaster ride, and you actually don't know what's going to happen around the corner because the around the corner isn't built yet.
Oh,
Yeah.
that's
You
Amen.
know,
That's
perfect.
the perfect description.
right? And she's able to help with that. So I would put hers up there, maybe even at number one.
Awesome.
Working with her has really, really helped. It hasn't improved all of my symptoms, but you also can't promise someone that all of their symptoms are going to get better. And I would say the next thing that was most helpful was hyperbaric oxygen therapy. I know there's a lot of talk about that right now. And for me, I feel it has helped. I think with inflammation and swelling and tissue regeneration and my capacity, I feel has improved because of it.
Maybe briefly for our listeners who aren't aware, hyperbaric oxygen therapy, short also HBOT, is a kind of therapy where you go into a pressurized chamber where you also get 100% oxygen delivered. In a regular room, you have about 21% oxygen. And in the hyperbaric oxygen chamber, the surrounding air pressure is increased. So at regular sea level, surface level, we have a pressure of about 1 atmospheres, or atmospheres absolute. That is the measurement that is used to measure air pressure in this context. And when we dive underwater, for example, the pressure increases, and the same happens in HBOT. So in HBOT, the pressure is generally 2 to 3 atmospheres, meaning that the pressure is increased 2 to 3 times that what we are used to on surface level. By increasing the surrounding air pressure, your body can dissolve more oxygen directly into blood plasma. Normally, blood oxygen is carried by red blood cells, but under these conditions, even the liquid part of your blood, so the plasma, carries a large amount of oxygen. And this means that oxygen can reach areas with poor circulation, speed up healing, and reduce inflammation, and even help fight certain infections. And that's why HBOT is used in medicine for things like carbon monoxide poisoning, decompression sickness in divers, or even hard to heal wounds, and sometimes even in severe infections. So the effects of HBOT are known. It is known that hyperbaric oxygen therapy helps with certain things, but the effects on long COVID are currently still being studied. And it's still somewhat controversial. A lot of people have mentioned that they get PEM from going to this kind of therapy, which can happen. I'm not going to downplay it. It is a real risk that exists. And of course, there are other risks of HBOT as well, such as middle ear injuries, short term changes in sight, and even decreased lung function.
So, in the case of long COVID, it's proposed to help with things like neuroinflammation, neuroplasticity, improved mitochondrial energy production, or enhanced microvascular repair. And small trials have shown improvement in things like fatigue, brain fog, and cognitive function. I guess only time will tell if this therapy is effective and helpful for long haulers. Right now, it's sadly not broadly accessible as it's usually not covered by insurance. So, how did you do hyperbaric oxygen therapy, Noah? What was your experience?
I have done two 60-day sessions with some break in between.
Okay.
I was started super low with 45 minutes at like 1.5 atmosphere for 2 weeks. And then I moved up to 1.8 and then 2.0. And then I ended up bumping up to 2 hours throughout time. I did have a bad experience on one occasion. It didn't stop me from doing it, but I did have to take a break. I would do my home chamber. My parents were fortunate enough to find a doctor who was selling his 2.0 atmosphere chamber. And my parents bought it we're
Oh,
so grateful for it. I'm
that's
so incredibly
awesome.
grateful for a couple
Yeah.
$1,000s. And it works great. It is not air conditioned on the inside. And
And
so it's a sauna. Normally, if you go to a clinic who does it, a hard shell chamber or even a soft shell chamber there is usually has an air conditioning unit thing attached to it or in it to make it a much better experience. But when you're able to buy one to have at home, it's almost like you'll take what you can get and what you're grateful for. So I drip sweat a bunch and I had gotten water into my ear canal and the pressure in the water created an infection
Oh,
in my mastoid bone and in my ear. And so I went to the doctor crying in pain, not feeling well already. And then I had to go on another round of antibiotics. And I've been on way too many rounds, as a type 1 and like poor wound healing with that as well. Way too many rounds of antibiotic. I will say for HBOT, that is something that can happen. So you just have to be wary of that. I think that was just a freak incident. I've not had it happen again. And I still use my HBOT chamber today.
if you feel comfortable talking about this,
Yeah, sure.
how much did it cost when you went to the doctor's office and did it there
To the
instead of at
clinic.
home in the clinic?
Um, Usually they do like a package, and a package of 10 sessions is about $1,000 at least.
okay.
Okay.
It's actually not
Not
as
terrible.
therapies go
Yeah.
in the US at least, like for that amount of time, like you pay more to
Yeah.
see a doctor for less time.
Yeah.
So,
I was expecting worse because here in Switzerland, you'd be at around 10K for like 60 sessions, and they recommend.
Yeah, I'm sure 60 sessions would be upward that as well.
Yeah, it's really sad that this is just a general issue. HBOT is one of them, is that a lot of these therapies that seem to show promise are so expensive. And sadly, a lot of people with chronic illness who have been ill for a long time, we're living off disability benefits if we're even able to get them in the first place. And we don't
Yes.
have the money to spend 10K on an experimental treatment that
Right.
might make us sicker or might improve our health or might do nothing.
Yeah.
And
Right.
it's
And that's why we need research.
yeah, and insurance approvals. Like we need insurance to start covering the next generation tests, like higher quality imaging tests, genetic tests. So Noah, you also tried ozone therapy, which is another non-traditional therapy. Can you talk a little bit about your experience?
I found benefit with ozone. I felt it helped, even though some days when I first started doing it, I felt a little bit better, like maybe a few percentages better for just a day. And it started with that. And I was like, you know what? I know this is a lot of money, but I'm going to take all the moments of feeling good that I can get. And if my support system is willing to help me do that, I'm going to take it because I also feel in a way we're all our own pioneers in cultivating and finding out things for our community. And so for me, it's almost like I continued ozone therapy just because I was like, I genuinely want to see what this will do. And I found some benefit. Now it's not a cure all by any means, but I felt like it did help with oxygenation and improved fatigue.
We looked up the cost and availability of ozone therapy in different regions. And where I live in the eastern United States, a single session is around $350 and $800 for something called a high dose treatment. And prices in Europe are similar. And proponents of ozone therapy claim that patients need multiple treatments. So, this is another therapy that is out of reach financially for a lot of folks.
How did you get the ozone therapy administered? Because there's different ways.
Just through IV
Okay.
blood. They pulled my blood into a
Oh,
tube and put it into the bag, and then they have an O3 machine, and then they put it into the bag and with the blood, and then they mix it until your blood turns bright pink, and then they open the line, and it goes right back in.
That sounds so crazy. That
That's
sounds
so
like
sci-fi.
yeah.
Yeah, and it's really cool.
Were you doing that
Yes.
Yeah.
at the same time as the hyperbaric oxygen
Yes.
therapy?
Yep, at the same time, and I feel that if I didn't do it when I did, my outcome at where I am right now in my baseline would probably be worse.
I want to quickly add this for our listeners. Ozone therapy is still highly experimental, and
Yes.
we were not able to find any long COVID specific research on it, but it is thought that ozone can help improve with things like circulation, reduce inflammation, or help modulate the immune system. So I think it will be really interesting to see and observe more research and more studies come out on this.
Yeah, and it's very different than breathing ozone.
Yeah.
Breathing ozone is very
Very
bad.
different.
Very bad.
It
I can't even go outside when the ozone is high. Like my MCAS is like, nope. But also, even though it's IV administered, it is not risk-free. For IV ozone, there's a risk of air embolism, which can cause significant issues such as stroke or heart attack. So you have to be mindful of that with these sort of new therapies. You can read more about the risks and theoretical benefit of ozone therapy in our Substack write up, but there's still very little evidence right now showing its benefit over its risks.
Yeah, and with that ozone therapy, I also did, like, vitamin IVs and NAD a little bit too, and I found some benefit with those as well.
Oh, interesting. So for our listeners, NAD stands for nicotinamide adenine dinucleotide. I think I pronounced that correctly. And it is a coenzyme that plays a key role in things like energy production, DNA repair, and overall cellular health. One of its big jobs is to shuttle electrons around so our cells can make ATP, the energy that they need to function. And as we get older, NAD levels naturally decline, and that's linked to lower energy, slower cell repair, and a higher risk of age related diseases like Alzheimer's and Parkinson's. And that's why there's such big interest in whether boosting NAD might support healthy aging. The functions of NAD in the body are really complex, and I have to admit that I really struggle to fully understand everything, especially in the context of acute COVID and long COVID. However, it seems that SARS-CoV-2 actually drains NAD from our cells because it activates certain enzymes that use up a lot of it. And when those NAD levels drop, enzymes that normally help control inflammation can't work as effectively, which may contribute to the immune overreactions we see in a lot of long COVID patients. But as of now, there is not a lot of research available on NAD in the context of managing long COVID symptoms such as fatigue or brain fog. And pilot studies are encouraging, but we really need larger controlled trials to confirm whether these benefits are real, substantial, and reliable.
It also, like, a lot of people use it for, like, anti-aging, wrinkles, and I will say I did notice this, a few times ago that I had it done. I felt like the day or 2 after I got it done, I had a baby face. I was like, "Wait, my face looks a little bit different." And I think it just helped maybe with inflammation, I don't know.
Oh, okay.
Yeah.
It's an experiment, it's just to see, and I did feel benefit with it, but also I know increasing fluids in the body with people with
Yeah.
dysautonomia is also helpful, so I know that probably was part of it,
Yeah.
but I did feel a little bit of an increased boost in energy, just a
Yeah.
little,
Mhm.
and it may not last long, but it does something.
Yeah.
You also tried nicotine patches, right? Can you tell us a bit about that?
I started that, oh gosh, a couple months ago. My mom recommended it to me, the
Mhm.
protocol, and it was like 7 days on, 3 days off, 7 days on, 3 days off, whatever. And I did that, and I kind of felt like a little bit of a hassle to remember that, okay, this is the 7th day, tomorrow it has to be no nicotine patch for 3 days. So I did that for a little while, on and off, and then I found that moving up to the next level was not something I could do, so from 3.5 milligrams to, let's say, 7, that was too big of a jump,
Okay.
and so I've just been sticking with the 3.5 for now, and I use it practically every single day.
Okay.
I haven't felt that it's been a disadvantage. I do feel a little bit more energy, but I'm mindful to not overexpend my energy. I do feel like it has helped.
Of course, it's still very early stages for
nicotine patches, this therapy. So there doesn't seem to be a proper protocol yet, and research on it is still coming out. For listeners interested in nicotine patches, you'll find resources on this in our show notes. Essentially, Dr. Leitske recommends that non smokers who want to try nicotine patches for long COVID to always start with the lowest dose possible. So around 7 to 7.5 milligrams. For people who are very sensitive, he suggests beginning with only half a patch for the first 3 days. And in some countries, you can get like 3.5 milligram patches. Where you can't get that dose, you shouldn't cut the patch, but instead just only uncover half of it or cover that other half with tape. Because if you cut it, it affects the effectiveness. After this initial low dose period, he recommends moving to a full 7 milligram patch for 7 days and then stopping after the 10th day. This is because the nicotine receptors become temporarily desensitized and the benefits wear off, though they resensitize pretty quickly once the treatment ends. So, after the initial phase, there doesn't really seem to be a protocol one can follow. Generally, Dr. Leitske recommends taking breaks when needed or to only use the nicotine patches when you're in a symptom flare. So it seems to be pretty individual how it works.
I'm really excited to see more research come out about this. In one study, they did a PET scan where they proved that the receptor availability of those nicotinic acetylcholine receptors improved when you were taking nicotine. So the theory as to how nicotine helps in long COVID was basically proven. And there's a lot of surveys that have shown symptom improvement in long haulers. One showed a 73.5% improvement when people used a low dose transdermal nicotine patch. Right now, it's still pretty controversial, so I hope we will learn more about nicotine in the future.
Mhm.
What I am interested in knowing, Noah, did it affect your dysautonomia in any way? Because some people with
Ooh,
dysautonomia are
yeah.
very sensitive to stimulants.
Um, I think I'm not entirely sure that I had a negative reaction to it. I obviously did feel a little bit weird. And I know when you first start the patches, it can like definitely play with your symptoms quite a bit.
Yeah.
Maybe I was a little clueless, but I was like, oh, something's changing. And the change started happening when I started using the patches. So I'm just going to continue and see.
Mhm.
And I don't feel like it gave me like a PEM crash. So that's
Okay.
kind of my sign to like, okay, it's okay to keep continuing. It did cause me a little bit of discomfort. And I noticed my muscle twitching got a little worse for a while when I was on the nicotine patches, like at the very beginning, and it's kind of subsided. I only really get muscle twitches now if I overexpend or if I use my muscles a little too much.
And what symptoms do you think that, or did you feel that nicotine helped you the most with?
Fatigue.
Fatigue.
Awesome.
Yeah,
Yeah.
that's the hardest one to beat, in my opinion.
I would never wish fatigue on my worst enemy.
So, Noah, your baseline today, it seems like you're in a pretty decent place compared to where you
Yeah.
were.
Yes.
Talk a little bit about where you are today.
Yeah. Today, I feel I have partial recovery. I don't know what full recovery means. I have had some areas of improvement, and I am eternally grateful for it. I don't know how long it will last. I don't know if it's going to turn around tomorrow. I don't know. I'm trying to figure out what causes this PEM crash or what causes this flare and this symptom. What did I eat? What did I do? What did I drink? What time did I take this supplement? Like, there's no perfect roadmap for this, but I do feel because of my ability to be persistent and try and figure things out for myself and be experimental, because of obviously, like, my family's so gracious to allow me to do these things because I could not do them by myself right now. I do feel I have improved a little bit or at least stabilized. There's still some unanswered questions I have and things that I still am concerned over, things that I might think are developing or things that might be changing, but I'm able to go to work and be present 3 days a week, at least. I'm a coach, so if I'm not able to fully be physically active with my athletes, at least I'm able to be in the presence of them. And that's a win for me.
Maybe as a comparison, what did a day look like for you at your worst when you were right
So
at the
far,
beginning?
yeah, so far at my worst, in bed all day long, doom scrolling on social media, crying. I felt miserable, tired, exhausted, in pain, freaking out about changes in my body. And I feel I also attribute some of my improvement to the understanding.
Yeah.
Understanding where your symptoms are coming from is so helpful for your mind. I am lucky enough to be able to still call my friends and I'm able to talk to them about things still. And I have lost friends too, but my friends who are still here supporting me, I'm so grateful. I attribute them as well to understanding my condition and trying to make things more accessible and easy for me because my body is fragile. We are fragile. We're strong, we're resilient, but we have to give our bodies the grace it deserves and the rest it deserves. And learning to pace has also been so helpful, aiding in my recovery. And I think if I didn't do it earlier, I'd be in a worse place by now.
Thank you so much, Noah, for joining us today on our podcast and sharing your experience. We really hope that it's going to resonate with many people out there and hopefully also help a lot of people as well.
Right. And while today's episode focused on Noah's health improvements, the treatments he's tried that have improved his well being, next month's episode, we'll talk about some other insights from Noah's experience with long COVID. We'll discuss things like grief, having to medically retire at such a young age as an elite athlete, among other things. So stay tuned.
As a reminder, while our discussions offer medical related insights, this is not medical advice. Please always consult your healthcare team with any of your medical concerns. If you would like to connect with our Discord community, you can find the link to the server in our show notes, along with our Substack and socials. We aim to release episodes monthly, so please subscribe and stay tuned for future episodes. Until the next time, this is the COVID Long Haulers podcast signing off. See you on the next one.